Well, I like to disclose that last year I was sponsored by the ICS for the fellowship in Urodynamics and work in collaboration with Dr. Peter Rosier for this paper. So, as a background, studies that evaluate bladder filling during urodynamics are remarkably scarce. And talking a little bit about normal physiology, bladder filling causes the detrusor to unfold and the detrusor muscle is to stretch, and this stretch is what causes nerve end firing, and it can be perceived as proprioception and any other muscle. And mankind has learned to perceive the detrusor muscle distension as bladder filling sensation, and has learned to inhibit the innate autonomic voiding reflex to a mature socialized voiding. And talking a little bit about urgency as an element of overactive bladder syndrome, urgency is not specifically defined as a urodynamic observation, and is pathology under this symptomatology is not well understood. And this we got to this questions of how does sensation relate to volume as dictated by design of normal physiology, and how is the detrusor overactivity interfering with normal feeling sensations. And that's where the objective of this presentation is. It's to compare ICS bladder feeling sensation landmarks in a cohort of patients with and without the detrusor overactivity, and evaluate the association of the field volume with the feeling sensations, and evaluate the association of the detrusor pressures and the feeling sensations. And this study was carried out in Utrecht in the Netherlands, and it was a single center retrospective of observational cohort study. We reviewed urodynamic studies of female patients between 2005 and 2018, and we only included patients that had a complete report, especially old sensation landmarks, and excluded patients with the neurologic pathology and obstructive pathology. And all the patients referred to the clinic, most patients, the diagnosis for the studies were stress urinary incontinence, overactive bladder syndrome, and different lower urinary tract symptomatology. The urodynamics were carried out as according to the good urodynamic practice. The patient were in seated position. We used an 8 French transurethral double lumen catheter, a 10 French intrarectal catheter, and the bladder filling was made with room temperature solution at a continuous rate. Here are the results. We analyzed 161 reports of urodynamic studies, and of these, 109 presented without the detrusor overactivity, and 52 with the detrusor overactivity. And here we can see that the mean age was 59.1 years, and there was no significant difference between the two groups. And we can see here that there was a significant difference between the sensations and the detrusor pressures between the two groups, with the tendency of the patients with detrusor overactivity to have lower volumes and higher pressures. However, no difference were observed when sensations were measured at percentage of capacity. Sensations with detrusor overactivity are at a smaller volume of a reduced total capacity, therefore at identical percentages. And here in table 2, we graphicated all of the contractions the patients presented, and we got the means of the volume at the one that the contraction presented, and the difference, the volume between one contraction and another contraction, to trying to find a pattern between the one contraction and another, and we didn't find any patterns. But here we can see that 52 patients presented one contraction, 33 patients presented 2 contractions, and so on until one patient presented 10 contractions. And we can see that the detrusor pressure before the contraction and after and during the contraction was incremented between the patients that got one contraction until the ones that got that got 10. And in this table, we show the detrusor overactive contractions in association with the sensations, and we can see that most of the patients presented the first contraction before the normal desire, and now that we analyzed the whole contractions as a group, most contractions were present after normal desire. And as a concluding message, the bladder is a hardware is designed to sense muscle stretch represented by volume, and sensation landmarks are however shifted to lower volumes when the detrusor overactivity exists. This may be regarded as a clinical sign of sensory threshold shift to lower volumes, as postulated in preclinical research. And that's all.
From the audience. So when you have, of course, the patients with DO have a decrease, let's say, of their sensation, the volume at which. But when you compare to the volume, the percentage is not different. It's like if the system is set to a certain level, it can be shifted down by the presence of the detrusor activity, but basically it doesn't change. I mean, the ratio between first sensation and total capacity remains constant.
Remains constant.
No.
Yes.
So, do you think that this is a little bit in contrast with the fact that is a problem of efferences or not? I mean, because it looks like the only difference is the presence of the contractions that is shifting the perception. It's not an increase of the perception. If I don't know if I can explain correctly, but I mean, if this is only shifted to a lower volume,
yes.
It doesn't look like a problem of the efferences, but more to a problem of the detrusor contraction itself. I mean, putting down the Peter, help me to explain myself.
I think basically that is the hypothesis. How does overactivity influence sensation? And although Anna presented nicely, etc., but it was a good, and I'm surely backing up what she said. It's a little bit underpowered to really confirm what your hypothesis is. But basically, the question is, we are looking at sensation, we are looking at overactivity, and really, your question shows that we really do not exactly know. And we know that the hardware is the sensation of muscle distension, but we do not know how the hardware gets confused by pressure changes, and this provides a little bit opening of unveiling of what we know, but not everything. And I'm sure there should be more research. I'm going to do more research and to try and unravel that.
Thank you very much. No, sorry. Because we are...
Just one very fast question. Did you find any relationship between the detrusor overactivity numbers and urgency incontinence? The detrusor overactivity followed by incontinence?
Oh, no, we didn't analyze that variable.
Thank you.
Thank you very much again. So we move to the next